Let's walk through this imaging study. We're looking at arterial phase images from a CT scan of the upper abdomen. One of the most notable findings is the poor definition of soft tissue planes around the porta hepatis and the pancreatic head. Within the pancreatic head itself, there's a region of low attenuation. What immediately grabs attention is a vivid, rounded 2-centimeter area of arterial enhancement within that region. Now, when I see something like this, my mind quickly moves to differentials. The enhancement pattern makes me think of a vascular issue, potentially a pseudoaneurysm. If the patient has a history of pancreatitis, that could explain everything quite nicely. A pseudoaneurysm forming within a pseudocyst due to vascular erosion. However, without that history, we'd need to explore other possibilities, such as underlying malignancy, vasculitis, or even previous trauma or surgery leading to an aneurysm. Given the findings and their potential implications, I'd want to correlate with clinical history right away. A prior episode of pancreatitis would make the pseudoaneurysm diagnosis much more likely. In the absence of such history, I'd keep malignancy or an infectious vasculopathy on my radar. Because of the potential urgency here, especially considering the size and nature of this vascular lesion, immediate discussion with an interventional radiologist would be my next step. We'd likely consider endovascular treatments, possibly embolization or stenting, depending on the angiographic findings. A catheter angiogram would offer more detailed anatomy, helping guide intervention. What makes this case particularly interesting, and perhaps a bit challenging, is the need to stay open to different causes of this enhancement pattern while not losing sight of the urgency. This is exactly the type of situation where collaboration across specialties is critical, and prompt communication with the referring clinician would be vital to ensure the appropriate action is taken swiftly. In terms of anticipating potential questions, I'd expect the examiners to ask about the vascular anatomy here, why this region, how we interpret the enhancement, and the steps we'd take next. They might also push for alternative diagnoses if pancreatitis wasn't in the clinical history. And they'd likely want me to explain the role of further imaging or interventional techniques, especially in managing the case safely and effectively. I'd wrap this up by highlighting that cases like this demonstrate the crucial role radiology plays in both diagnosis and decision-making for potential emergencies. If you found this walkthrough helpful, remember to subscribe to Radiology Made Easy, and feel free to drop a comment if you've encountered similar cases or have any questions. Let's keep learning together.